Hello, I'm Guoguo. Today we're going to talk about medication management for CKD patients using hypoglycemic drugs. Notably, diabetes mellitus is one of the major causes of CKD. For CKD patients, managing diabetes and confronting a diverse array of hypoglycemic drugs, understanding the correct methods of oral administration holds significant importance. First, let's learn about the common types of oral hypoglycemic agents, including biguanides, sulfonylureas, glinides, alpha-glucosidase inhibitors, DPP-4 inhibitors, and SGLT2 inhibitors. Each drug has distinct effects. What should we pay attention when taking these medications? Metformin, for example. Brand name metformin primarily lowers fasting blood sugar levels and typically avoids inducing hypoglycemia. Its primary side effect pertains to gastrointestinal reactions. In order to mitigate gastrointestinal reactions, the administration of metformin involves a gradual increase from a small initial dose. The dose should be taken approximately half an hour before or after 3 meals and can be incrementally raised to achieve the optimal effective dosage of 2,000 milligrams per day. Sulfonylureas, for example, glimepiride, work primarily by reducing fasting and postprandial blood glucose levels, with the main drawbacks being hypoglycemia and weight gain. Typically, they are taken immediately before a meal or around half an hour prior. Analogues like glargine, for example, repaglinide, primarily target the reduction of postprandial blood glucose levels, while the major potential drawbacks encompass hypoglycemia and weight gain. Typically, these are administered right before meals. There is usually no need for initial dosage adjustments in patients with renal insufficiency. Glucosidase inhibitors, for example, acarbose, primarily focus on reducing postprandial blood glucose levels, while the chief adverse effect pertains to gastrointestinal disturbances. Typically, they are ingested with the first meal of the day. It's important to highlight that individuals using alpha-glucosidase inhibitors and experiencing hypoglycemia are managed with glucose or honey, as consumption of sucrose or starchy foods is less effective in rectifying low blood sugar levels. DPP-4 inhibitors, for example, sitagliptin, primarily work to reduce both fasting and postprandial blood glucose levels, and the principal adverse effect is related to gastrointestinal reactions. They can typically be taken with or without food. There is no need to consider dialysis duration when taking selagelin. The primary adverse effect of SGLT2 inhibitors, for example, dapagliflozin, is related to genitourinary tract infections, and this medication offers renal protection benefits alongside its glucose-lowering effects. Patients might find this information overwhelming. Remember the core principles: monitor your blood sugar levels, adhere to your prescribed medication regimen, and keep track of the frequency and dosage throughout the day. See you next time. Bye.